Duchenne Muscular Dystrophy is a genetic condition that is in a class of rare diseases and mostly affects boys.
Because this is a condition that is inherited, the boys get it from the mother, it's X-linked. And as we all know that mothers have 2 X's and fathers have 1 X and a Y, so the boys will get the X from the mother.
Although there is no clear statistics, it is indicated that 300,000 people globally are living with the condition, and in Uganda it is estimated that there are 250,000 individuals. Pediatric neurologist Dr. Robert Sebunya, working with Internship Hospital, explains that the disease leads to progressive muscle fiber degeneration and weakness.
This baby is born or boy is born normally, develops okay. In some they could have delayed in walking and even delay in talking. However, as time goes on, you'll find that they will have delay in walking. Running is becoming the problem. They trip while running, while walking, and eventually they start coming in. Actually, retrospectively, the parents may not know, may think that this child is just making up things. But with time, you find these children start failing to walk. They progressively get muscle weakness, and they'll have big calves, and then they are unable even to comb their hair because the limb girdle, the muscles within the girdles, either the shoulder girdle or the hip girdle, are very weak.
Individuals diagnosed with the condition face challenges with walking, and by the age of 12, many are reliant on wheelchairs due to muscle degeneration. Lunkse Simbwa, a mother of a child with Duchenne Muscular Dystrophy, recalls how she moved from one hospital to another.
We were referred to one neurologist who was able to diagnose a child with Duchenne Muscular Dystrophy, a condition that is so painful as they introduce to you as a parent, because when you give birth to this child, the child looks normal and you're expecting good progress, only to tell you that he has an ailment that is going to be wasting away his muscles as he grows up, and it's such a pain.
Dr. Birungi Deus Dedit is also living with the condition and can no longer work due to continuous muscle wasting.
And I did the program successfully, completed. I went to Zambia for internship. I did internship successfully. However, because of the condition getting worse and worsening, I'm no longer involved actively in practice, actively in clinical practice, because of the degeneration that I have undergone and the significant weakness I have suffered. But now I would consider it a risk to the patient and to myself if I'm doing being involved directly in day-to-day clinical practice and treatment of patients. So I no longer do that because I have gotten significantly weaker compared to when I was doing internship or when I was training as a medical doctor.
It is against this backdrop that CoRSU Rehabilitation Hospital has started a clinic where children with the condition can access multidisciplinary rehabilitation services.
Neuromuscular conditions are quite many, and in our communities they are often misdiagnosed, they are often ignored, and they are often misconstrued as other problems. For example, witchcraft, among other things. We decided to open this clinic and to create awareness for our patients, because the number of patients that present with these conditions to us are actually quite many.
So the motivation is to really offer care to these children and to have the parents know that there is hope. There is hope, and we've got to start from somewhere in order for us to end somewhere.
This is going to help in raising awareness, but in also reaching many children with a condition that is most often under-recognized. And once you start an initiative like this, once the awareness is spread and many children are reached, we shall have more children being diagnosed and more children being addressed and treated.
The Ministry of Health commended CoRSU Rehabilitation Hospital for the initiative and pledged collaboration.
Ideally in Uganda, it's something which is a gap. We're estimating that around 250 boys have these problems. But this is not all that we have. We are sure that we are having many of these conditions.
Although Duchenne Muscular Dystrophy is among the rare diseases, it is one of the most neglected conditions, and it is therefore critical that there is awareness creation about the diagnosis and where patients can seek rehabilitation services. Diana Koche, UBC.